Hi, my name is Mary Clarke. I'm a nurse practitioner in GI Motility in San Diego. Today, I'll be talking about the benefits of complementary alternative medicine, such as exercise, and creating healthy routines to improve IBS symptoms. The reason why we're talking about the benefits of exercise in treating IBS is because oftentimes patients are seeking an alternative approach to treating IBS, either as monotherapy or possibly also in addition to taking their medications to treat IBS. So the primary reasons why exercise can improve IBS symptoms start with the idea that by improving gastrointestinal motility, this helps increase peristalsis throughout the GI tract that stimulates bowel movements to complete bowel evacuation. In releasing stool from the colon, this reduces the pressure exerted on the walls of the colon that results in a reduction of pain and possibly bloating associated with IBS, in particular IBS-C. Oftentimes, stress is associated with the exacerbation of IBS symptoms. Exercise can increase the release of endorphins, that's the body's natural mood-enhancing chemical, and in doing so, can create an improvement in emotional health and reduction in stress. Exercise also helps by increasing blood flow to the gut. Particularly when this is accompanied by a healthy diet, this may improve absorption of proper nutrients for a healthy gut that can improve digestion. As we learn more about brain-gut disorders, there's evidence to suggest that regular physical activity can positively influence the gut microbiome. This is accomplished through a few avenues. One way is by the action of moving waste through the colon in a timely manner that reduces that risk of a florid buildup of bacteria in the gut. Also, the low-grade chronic inflammation that patients may suffer can be linked to IBS. During exercise, we release certain chemicals from our muscles called cytokines. These may initially create an inflammatory response, but post-exercise. But this then can trigger the release of anti-inflammatory chemicals that ultimately results in reduction in inflammation. The result of releasing these chemicals during exercise may help to reduce the frequency and intensity of IBS flare-ups. So what type of exercise helps a patient who has IBS? There's multiple studies looking at different types of exercise, but establishing a regular exercise routine that can involve aerobic exercise can play a significant role in helping with IBS symptoms. The Department of Health and Human Services recommends 150 minutes of moderate exercise per week. While this may be a helpful guide, establishing recommendations for exercise may vary from patient to patient. For patients who aren't sure where to start, I often suggest by taking a walk on a regular basis. The number of minutes may vary from patient to patient, and it's really going to depend on what is their current regimen. For example, if I have a patient who is sedentary and complains of knee pain, I might suggest that they start with a 5 to 10 minute walk 3 times a week. During their initial visit, I often review with the patients the benefit of exercise, as previously highlighted, including that stress reduction, improvement in defecation, and reduction in inflammation, to highlight the reasons why exercise becomes so important. I remind patients that exercise should be pleasurable. If taking their dogs for a walk is stressful, I recommend that they walk without their dogs or have a partner or a buddy who can also motivate them and possibly keep them distracted. Listening to music is also a good distractor while exercising, with less focus on the exercise part, particularly if they're resistant to exercise. As patients engage in exercise, I recommend that they start to increase that activity about every 1 to 2 weeks, start to increase those minutes, and increase the number of days per week that they exercise. If patients are unable to engage in a walking program, there's other aerobic exercises such as cycling or swimming that can also be beneficial. Some other forms of exercise that have recently gained some attention, there's some older studies as well as some newer studies looking at the benefits of yoga. Several small studies have looked at populations and found that there can be a benefit to yoga for a few reasons. Yoga fosters this mind-body connection, allows the individual to tune into their body's own signals. This can lead to a better awareness of their IBS symptoms and maybe help them identify certain triggers and helps them kind of navigate through those triggers. Yoga also focuses on breathing exercises that can be particularly beneficial for patients who suffer issues from constipation. By using diaphragmatic breathing exercises, this may improve that generation of force needed to promote a bowel movement. Posture is also enhanced with yoga. Poor posture can add additional pressure to the intestines, and this may impede defecation. Yoga promotes relaxation that can improve blood flow to the digestive organs and improve digestion and reduce bloating and constipation symptoms. Lastly, there are certain yoga exercises that involve bending and twisting that may help promote blood flow in addition to just the regular yoga exercises. While exercise is beneficial for IBS-C, it's essential for patients to find that balance. Overexertion or high-intensity exercise may potentially worsen patients' symptoms. So it's important for patients to focus on that moderate intensity. And ultimately, hopefully, the patients will find that benefit of exercise in enhancing their quality of life. Thank you for listening. For more information, please visit the GHAPP website or GHAPP ACE app.